Thank you very much. So I just want to begin by saying thank you so much to all of the teams. I feel really proud of the whole challenge. I feel like every single one of the projects has demonstrated how you can tackle sustainability, social value, clinical outcomes, patient or service user experience all together and make a difference. And I genuinely believe that is what quality improvement and service improvement should be about. That should be normal. And you guys are sort of really showing by doing. And your case studies are going to be so valuable to so many people. And I'm also really pleased that this is part of the bigger project, so that we've got the colleges and everyone else in the room here to help us think through how do we take the learning from each of these projects forward and see how we can support similar changes or integrate them and different services. And I think I really give credit to all those teams that have taken on the quite long-term preventative approach and tackling things where there's sort of culturally, not just in terms of sort of ethnic culture, but just within the health service, we don't have culture of always being able to, do the things now really well that pay dividends over across many years in the future. Also the working together with the different members of the team, and are those projects that really brought together the obstetrician team with the midwifery teams and all the other allied health professionals. So they've been fantastic. There were loads and loads of things to commend, but I'm going to hand over to my three co-judges who are going to tell. First of all, we're going to have two highly commended, in no particular order, teams, and then there'll be the winner. But yes, so I will hand over first to Emma to introduce one of the highly commended.
Thank you, Frances. Yes, so I've got the very exciting job of announcing the first highly commended team. Again, just to say thank you to all of you for your brilliant work. When I first got involved in this work just over a year ago, I was a little bit unsure what the interest would be like, not only from clinical teams, but from, service users in our lived experience group. And this has definitely been my favourite piece of work over the last year. I've absolutely loved working with Maddie and Rachel. It's been brilliant. So I'm not going to do a Simon Cowell. We've just had that discussion how I should, wind it out kind of thing. So the first team who is highly commended for their project is NHS Orkney for upskilling staff to provide local hip dysplasia screening. Absolutely brilliant project. Well done, Lauren and team. Absolutely love your tenacity and determination. I think for me, it's all about the rural care. That is, those service users tend to be the ones that are just completely forgotten about as well. It's not something that, is on everybody's radar, and it must be really tough for those families in that postnatal period to have all that extra stress, that extra worry, being on their own. We felt that your service user engagement and the results, it definitely drove your project. And I think how you said about that you'd hit a wall, but actually that just gave you more determination. We really loved your project, and we're very excited to see what's next for you and the service and the staff that you work with as well. I think that's another important thing. I know obviously from the lived experience group, we were all about the service user, their experience, personalised care, not widening inequalities, but actually what you've done for your staff as well. I think that's absolutely brilliant as well. So well done, Lauren and Orkney.
Thank you very much. I'm delighted. Lovely feedback. Thanks, Emma.
Oh, you're very welcome. Well done.
Thanks, Emma. Congratulations, Lauren. I think next we'll come to Fiona.
Yeah, that's me. And I'm not going to echo, I agree with everything that has been said. It's been an absolute joy to listen to these projects. And a good reminder that there is so much good practice happening out there that sometimes we don't get the opportunity to hear about very much, because often it's the bad stories that come to the forefront. So I really think to have this opportunity to shout just what you have achieved is fantastic. And I hope we'll continue to shout louder about all your projects and what you've done. So I have the pleasure of announcing the second highly commended project. And I'm very pleased to say that it was the Improving Postnatal Hypertension Care at Imperial College, NHS. Fantastic, really, really interesting project. I think for us, the reason that this one sort of sneaked into this position was it was really clear, first of all, the multi-professional team and the impact, and a real strategic choice of project for why that this was needed in your area. There was really clear evidence, well, taking evidence and putting it into practice. And sometimes that knowledge translation and actually applying evidence to practice is not always the easiest. But what you've done is create a slicker service provision for those women and families, which we know is also a very, very worrying time and anxiety-inducing time in terms of if things are not going well. And evidence there that you've got potentially a real long-term impact between your pre and your post audit and what will happen going forward. The fact you can get something like this into a local sort of policy or a protocol is really, really important, because it shows that you've got that chance to keep this going over a longer period of time to measure outcomes. But equally, it's transferable. You know, what you have done and that the approach that you took to finding the solution to this actually could be picked up, placed in other areas of care within your region, but equally another area around the UK could also do something similar with this and use similar approaches to improve the quality of the service that you're providing. So congratulations, well done. It was a real joy to hear about. Thank you.
Thank you. That's very kind and lovely feedback. And yeah, we hope that it continues to spread around awareness and improve things for women.
Ian, congratulations, Tom and Marissa. I can see you there as well. Thank you, Fiona. And next we'll move on to Ranee, who's going to announce our winning team.
Well, absolute pleasure. Shall I tell you something? I mean, it's been a wonderful morning. When I became president of RCOG, you set your priorities when you're president. They say, what do you want? And I said climate change and sustainability would be one of my other two. And people commented, well, why is this so important? And I said, if we want to improve the health of women and girls, this is something we are going to have to tackle, because it is one of the greatest threats to women's health. And still, those of us on the front line are just so busy trying to manage everything that comes our way that we tend to forget this. So congratulations for taking the time. I tell you quite honestly, when we set out to do this, I wasn't even sure we'd get so many people interested. So I'm so happy to hear this. But our winner today, and we had great difficulty deciding on the winner, by the way, was the reducing impact of nausea and vomiting in pregnancy. And congratulations to Beth, Laura, and Sophie. This, as I said earlier, is an area which we do manage really poorly. In secondary care and primary care, women are just go from pillar to post trying to find the best care. Our protocols are not good, our systems are not good, and we fail these women. So what you have done is really set a pathway which will benefit not only women that you look after, but hopefully when we are able to socialize this, more people will say, yes, this is what we need to do. The other thing is you all have worked together. I love the MDT approach. It's really important in today's climate. But in addition to that, you've used your virtual wards, your IV service in the community. And again, as Fiona said, that can be transferable to many other things that affect women and girls. So it's something we all have to think about. There's impact financially. There's your approach was good, and you also had good evidence of impact. So many congratulations. But that doesn't mean that the others didn't do well. Unfortunately, there can only be one person at the top. So congratulations to all of you.